In healthcare, there is often too much information and not enough time. Here at the Melanin Initiative, we avoid TMI by breaking things down into language you can understand. We create a safe space for you to ask your questions and share a nursing perspective without taking up too much of your time. We're so excited to welcome back Rochelle Dumas. She's a nurse, she's a grad student, and soon she'll be working on her doctorate. In her first episode, she was kind enough to share her nursing journey and also her personal experience with pregnancy loss. In this episode, we're going to find out more detail on how she turned that pain into a purpose-driven life, founded her business. She's out in the community, changing lives for the better, and her vision for the future, which is I'm super excited to share. I cannot wait to get into this. We have a lot to cover, so let's get started. If you're new here, welcome to the Melanin Initiative. I'm Dr. Kimberly Madison, a doctorally prepared nurse practitioner and one of your co-hosts here at the Melanin Initiative, along with Alicia and Geraldine, who send their love in their absence. We're a health literacy podcast. When we say health literacy, we're talking about your ability to obtain information, to understand that information, and then to use it to manage your health and advocate for others. It's our hope that by watching on YouTube, LinkedIn, Facebook, or Instagram, or listening on any of your favorite podcast apps, that you'll be empowered to ask questions, educated on how you can manage your health, and confident to navigate the healthcare system. We also love to elevate the expertise of nurses. We compose the largest segment of the healthcare workforce, yet there are a lot of people who still don't know what we do. And while many of us are taught to or encouraged to be a nurse or a doctor when we grow up, all of us will tell you quickly that there's a lot of people that make this industry run. And by hearing about them and being exposed to other options, it might be a right fit for you. So many people are entering the healthcare industry straight out of high school or as a second, third, or fourth career. And so we're just here to share stories, expose you to people who can inspire you. Maybe you can partner with them. Maybe they can be a mentor or a preceptor. And we're just giving you a frame of reference for an opportunity to make a difference. Because that's why most of us get in. If you ask someone, why'd you do it? They're going to say, I wanted to help people. And we're pretty sure you can relate to that. If you haven't already, this is your chance to subscribe, leave a thumbs up, put a few comments. It lets the algorithm know this information is important so that when people like you look for information like this, will show up higher in their search results. Remember, this show is for educational purposes only. The opinions expressed here are opinions alone. They're not a representation of any of our affiliations. If you're experiencing a medical emergency, you should seek medical attention and medical guidance from your healthcare provider. If you think you might be having a physical emergency, you should call 911. If you think you might be having a mental health emergency or know someone who might be, you can call 988 or text 741-741. Rochelle, welcome back to the Melanin Initiative.
Thank you, Dr. Kim. Thanks for having me.
Yeah, so we want to invite people to go back to your first episode and hear your journey in detail. But if you could give us that elevator pitch on who you are, what you do.
Yeah, absolutely. My name is Rochelle Dumas. I am a
Ooh,
registered
Dumont.
nurse. I'm sorry.
Dumont.
Yeah, I'm from New Orleans, so a lot of us have French last names.
I love it.
Yeah. I'm Rochelle Dumas. I'm a registered nurse. I've been in healthcare for over 10 years. I am a nurse informaticist. I'm also a nurse entrepreneur. I started my first company, Onward Healthcare Solutions and Education, which helps with compliance in smaller healthcare settings in 2020, as well as a nonprofit organization called A Light After Nine, which I started this year to help with maternal trauma. So I started that nonprofit after experiencing maternal trauma myself after a 4-year pregnancy journey where I had 8 miscarriages and a stillbirth.
Thank you for sharing. And you're coming to us from where now?
I'm coming to you from Atlanta, Georgia, but I'm from New Orleans, Louisiana.
Do you still have family there?
My entire family is, other than my immediate family, is actually in New Orleans. They went back in 2009 when I was in college, and we evacuated to Atlanta in 2005.
Okay. So you kind of hinted that you had a personal experience and then you committed yourself to helping families with similar struggles. Can you share more about that decision?
Absolutely. So it was a very dark and traumatic pregnancy journey for me. It didn't get better until a month after, or actually when I had my baby. So my pregnancy journey was plagued with issues with healthcare access, and I live in Atlanta, a pretty major city. I had issues with bedside manners, issues with advocacy during my pregnancy, failed surgeries, and so many other issues with mental health because of the amount of losses that I had. And because of that, I wanted to create a company and organization to help others who are going through similar issues.
Wonderful. Can you tell us what a light after nine is and the vision behind it?
Yeah, absolutely. So a light after nine, which I named because I had 9 pregnancy losses, and my light is my son. We do a host of things to help you along your pregnancy journey, especially for those who are going through losses and fertility issues, like myself. So we do grants, we find mental health resources, we do referrals to other doctors. So if you need a specialist specific to your journey, we can help you find that wherever it is in the United States. We also do a mom to mom mentorship. So I found out on my pregnancy journey that sometimes a group setting isn't the best for all of us, and sometimes we need more than that one on one counseling and therapy. We need somebody who has gone through this struggle, can grab our hand and say, "Come to the light, it will happen for you." So that is one of my favorite services is the mom to mom mentorship, and the one I do the most. So if you're going through that journey, reach out to us and I can tell you about my struggle and tell you how to get through it through yours.
And so, who's on your team?
Yeah, so we have a team of interns. We have one for outreach and procurement. We have social media manager. We have those who create content and those who follow up with organizations such as March of Dimes and other maternal organizations to come together to fight this struggle because it takes more than one organization and one person. It takes truly a village, a worldwide village.
I could not agree more. So, if someone's going to be your client, let's walk them through that experience. I guess the first point of contact would be visiting your website.
Yeah, you can visit my website or social media. We've had clients who have reached out via DM, who have reached out via phone, who have signed up on our website. So whatever way you choose, we're here to help, and we check all of our social medias, the website and phone, all the time. So you're not alone. So you can reach out whatever way you feel comfortable. I know when I was pregnant, I sometimes I could call, sometimes I could text. We want to make it easy for you and seamless.
And so they go in there and they schedule like a consult, or how does that work?
Yeah, absolutely. So you can just ask a question if you have just sometimes we just have a question or need to bounce an idea off of. So you could ask a question, you could sign up for our newsletter, you could schedule a consultation with us. So if you have quite a few things that you need to talk about, it's more than, just a phone call worth of things. You need doctors and mental health resources and grants and all these things. We encourage you to schedule a consult so we can sit down, get an idea of everything that you have going on with your case, and then we allot you those resources. Depending on how many you need or what you need, it could take a couple of days, but we typically have it back to you within 48 hours.
And these visits, are they online or in person?
Yeah, so everything is virtual. We either do virtual visits like via Zoom or we do it over the phone. So whatever your preference is, and depending on what you need, it might have to be a virtual visit via Zoom.
And how long are the visits? Is it just case by case?
Yeah, it's case by case. So depending on what you need, some have lasted 15 minutes and others have lasted almost 2 hours, depending on what you need. But typically a visit could last anywhere between 30 minutes to an hour.
And what is the payment?
So right now for this service, you don't pay anything. We're completely free and we're working on grants, off of grants. So it's completely free to you and whoever needs it.
Wow, what an awesome service. And so, how can people support you in this mission?
Yeah, absolutely.
Financially?
Yeah, absolutely. So if you are a maternal health organization agency, please reach out to us. We love to partner. We love to do community fairs and outreach. We would love to speak at your conference to bring awareness to all the different ways to treat maternal trauma and maternal health care. We are very excited about this initiative and want to be as involved as possible in as many organizations as possible. Like I said earlier, it takes truly a village, a global village to fight this. If you are a patient, or if you are someone who has sympathy or empathy or just want to donate, please go on our website and donate, or you can reach out via DM, phone, to just send a donation. We take all donations and they will go to helping whatever patients and people who reach out to us who need resources. It will help with that. And if you're a hospital administrator or a hospital executive, please, please, please reach out to us as well. We are trying to start our services at the bedside where it's needed most, and then follow these patients well after the bedside where they will still need these services and need that help.
Yeah, because you shared with me in our brainstorming session that a lot of the like experiences that you had, you were alone. Even if later on you did and have to go to the hospital or see a provider, a lot of those moments when they first happened and certainly the aftermath, you were handling that by yourself.
Right. And like I said, I have worked in quite a few different specialties: trauma or ICU, LTAC, education, informatics. I did not work in maternal health, labor and delivery, OB. So I was a new patient. And other than knowing how to save myself, I didn't know the things I really needed to know along my journey to advocate for myself. So we need this service, and others need this service who are going through this struggle because they need that type of advocacy.
And speaking about the struggle, what are some of the main challenges families face when navigating infertility, pregnancy loss, and maternal health struggles?
Absolutely. It's so many different types of struggles. The biggest one is probably mental health. Loss is the grief that you experience from loss can be overwhelming sometimes. And you need those resources to help facilitate effective coping. It's expensive. You need grants, you need money to pay for this, the hospital visits, the treatments, the medications, the surgeries. Those add up. So you need that money. I'm not rich, so I definitely could have used more grants than I had access to or even knew about, you know, during my pregnancy journey and thereafter, because the bills last longer than the journey sometimes. We also need specialists. Sometimes when we're in a pregnancy journey and we're facing this trauma, you can't even think about all the things you need, and there are a lot of needs: doctors, money, mental health resources, um, a friend who can tell you about their journey to let you know you're not alone. You can't always find those things. So you need somebody to come and say, here, these are the resources. You may also need this while you're not thinking about it. And we're going to make it easy for you. So here's your therapist, your hypnotherapist, your reproductive endocrinologist, here's a grant for $5,000 to help you with that bill. So you need so many things during this journey. And you also, as somebody who is supporting somebody giving birth or going through that journey, like a spouse or a boyfriend, girlfriend, significant other, wife, they need support too. A lot of times the significant other or the partner feels powerless during that journey. So we also offer support in forms of groups and therapists as well to help the significant other as well.
You brought up a good point. And even Anthony Young brought this up too. So I think there's two surprises when we talk about being a patient, right? One is that a lot of the care is up to you, the person who's not the expert, because
Right.
your encounter with us is so short term
Right.
compared to how much time you spend by yourself and the lack of information you have to support yourself, right? That's why we're doing this whole show is health literacy.
Mm-hmm.
The other, I think, surprise is how much caregivers play a role. In fact, because of what I think the last episode, I went on a little tangent about the long term care setting and the clinicians who work in that setting. Um, I think it comes as so through that experience, I've realized that the caregiver is the most important person on the team,
Yeah.
right? Because of what you just said, if you're the patient, your brain is either all over the place or nowhere,
Right.
right? Depending on what information you're receiving, how your body, whatever condition is affecting your body, the medications, the stress, all even in a healthy state, we can only remember 30% of what someone else said. And that's English, layman's terms. It is not medical diagnoses with
Right.
unknown outcomes and a lot of stress because all these things happen when we're in the middle of living
Mm-hmm.
and life keeps going,
Right.
even though you have had this moment where you've had to stop and reassess everything. Yeah, so I love that you're bringing up resources. Now, when you were talking about grants before, I thought you were talking about for your business, but it sounds like you're talking about for the patient.
Oh, yes, these are grants. Well, we do have grants that we apply for our business to help sponsor these patients. But we also offer resources, and we'll be starting our own A Light After Nine grant
Mhm.
to help patients. These are all for our patients because that struggle, like I said, has lasted long after my pregnancy journey. So, fertility treatment, surrogacy, if you decide to go that route as well, pregnancy journey, we have grants for all of those phases of pregnancy, of your pregnancy journey. So please reach out to us for that because I know how difficult that could be.
And so this idea of people getting grants, they'll come to you, you'll hear their information, you'll apply on their behalf?
Yeah, so I would assist with applying. I
Mm.
don't completely apply on their behalf, but we offer it if you want to apply by yourself, or we can do a Zoom call and we can go through the application together.
Wonderful. Maybe, I just listened to this episode on Forbes, and the lady who was on, she was talking about how she started a venture capital fund, and just hearing you talk about this idea of giving grants, it just popped into my head. I've never heard that in the healthcare setting, but maybe that's an idea.
Yeah, we need it though.
Yeah.
Medical bills are so expensive, and to already be going through such a traumatic event, even if you have a healthy pregnancy, it still can be considered a traumatic event. You know, being pregnant and going through childbirth and labor changes you in so many ways. You don't want to go through that experience and then be boggled down with medical bills. It's a very horrible experience, and it could be even more stressful than the situation already is.
Speaking of stress, what message would you like to share with individuals or couples who feel isolated or unsupported during these challenges?
The first message is that you are not alone and that it is scary to talk about, and sometimes it's taboo to even speak of loss. But it's so important to share your story and get your story out there. I myself was afraid to share my story. I mean, I kept this in for over a year. I mean, really for years. I didn't talk about my fertility journey outside of my very small friend circle. You know, some even family members are going to listen to this podcast and be like, what happened? You know, so there's this stigma in society that women are supposed to have a baby
Mm.
and it should be seamless. And for those women who choose not to or have struggles to produce a child, sometimes we feel guilty and sometimes we do feel isolated. But you're not alone. There's so many other people, unfortunately, going through the same struggle as you are.
So I am one of those women who I don't have children, and I didn't have any infertility issues, and it wasn't necessarily a choice not to. It's just the course that my life has taken. And so, as a woman of a certain age who doesn't have children, sometimes I don't feel seen when people are talking, right? Or when they talk to me and they're talking to me in the tone of "there's still time," or "it will happen for you." Like, that's not even on my radar,
Right.
like, I'm not really thinking about it, and so the message is always like, I need to be soothed, I need to be comforted, I need to be reassured in my value as a woman.
Yeah.
I know they have good intentions, like, I know that, right? But, everybody's story is just not the same, and we all grow up in the same world. We all grow up thinking we're gonna go to college, get married at 25, have 2 kids before 30, in a in a
It's so
really
funny to even hear that.
in a really nice community with a fence and a dog, and then what happens? It's over, right? That's the dream, right? It's over. So
Yes.
then when people are 30, they feel like they're run out of time. It's too late for them, and people who are older are thinking, "What are you talking about? Like you just entered the real world,
Right.
like
Right.
you have so much ahead of you, right?" And
Right.
so um, Thank you for allowing me to be seen today. And so, one thing I really am excited to talk about is your vision for the future. You give a little bit of a hint earlier when you brought up this concept of maternal palliative care. I would
Mhm.
love for you to share more on that and your framework that you're putting together. Yeah, so let's hear it.
Hi, I'm Alicia from the Melanin Initiative podcast. Our mission is twofold. One, to simplify complex health information so you feel empowered to ask questions, educated on how to manage your health, and confident to navigate the healthcare system. And two, to elevate the expertise of nurses, spotlight the diverse career opportunities within the healthcare industry, and inform our peers how to leverage their expertise as clinicians and entrepreneurs. In less than 2 years, we've grown to over 50,000 views and 1,000 downloads, with an international audience spanning the US, Canada, the UK, Australia, and more. Our engaged listeners are professionals, entrepreneurs aged 25 to 44 who value authentic, impactful content. Want to connect with this dynamic audience? Advertise with us. Send in your 1 minute video ad and let's amplify your brand. Email tmi.melanin@gmail.com for rates and details. Let's work together.
Yeah, absolutely. So, like I was saying earlier, like I touched on earlier, in order to effectively and holistically treat maternal health patients, especially those who are going through maternal trauma, we really have to change our approach because our numbers are rising, especially for Black women. You know, maternal death rate is so high, especially in Georgia. It's almost scary to think about giving birth at this point because we're literally risking our lives to bring a life into this world. So, because of that, we really have to try new approaches. And my idea was to implement palliative care into the maternal health setting. Right now, most hospitals, if not all, have a palliative care department. However, they're not trained in maternal care. If you take a palliative care professional and just throw them on any, part of the maternity ward, whether it's labor and delivery or postpartum, they're going to be like, they're going to be limited in what they can do. So a new specialty has to be formed where there's a cross between palliative care and maternity education and experience so that we can make sure we're advocating for the patient as well as making them comfortable through their treatment. Equally, thereafter, they need case management and palliative care because the pregnancy journey does not end at the hospital. Whether you had a loss there and may want to try again later, or you're trying for surrogacy, or whatever the case may be after, it still does not end. So we need those services to start at the bedside and last for however long, months, maybe a year, with these patients.
And you've done a really good job bringing to our attention these other areas where nurses really should be well informed. We talked about tech, we've
Yes.
talked about money. And now, in this framework that you're developing, not only do you want to bring an emphasis to developing palliative care, palliative maternal care competencies, standards of care, scopes of practice, curriculum, as well
Mhm.
as that case management that's attached to that interdisciplinary team,
Right.
you want to make all of this an employee health benefit. Talk about that.
Yes. Yes, absolutely. So, like I said, a lot of my pregnancy issues and a lot of our pregnancy fertility issues did not did not make it to the hospital setting. They happen at home. Most of my miscarriages happen at home. I might have follow up with the OB later, but it happened at home. And we spend 80% of our time at work, whether we're actually working, focusing on businesses. A lot of us work at home and we're working through our miscarriage. I've done it before, unfortunately, but we need a benefit through our employers and the support of our employers to make sure we have all the care that we need, including this service. So if your employer is offering this, they're already a step ahead of so many other employers who may not be as what's called progressive, meaning they're not paying attention to what we need as birthers and women in our maternity care journey. So I really want employers looking at this podcast to really reach out and talk about how we can help those who are employed for you, who are birthers and going through fertility journeys and going through uh, pregnancy journeys and thereafter. And I want us to collaborate on bringing the Light After Nine services to them because they need us.
Yeah, I'm curious. I wonder if we should sit at the table with insurance companies, right? Because I think,
Um,
there's already the talk about the maternal care services that are being offered now are already slim to none, some people would say. And so
right.
now we're asking for more, and the employer might say, well, yeah, I'm all about it. But is the payer going to agree? So it's certainly a challenge that we have in front of us. What ideas or suggestions do you have?
Yeah. So while it can start with the employer, because we would be getting paid by the employer to provide services for whatever employees want to take advantage of these benefits, which would be most employees who are going through the pregnancy journey at some point in their lives, or not, but we can also talk to insurance companies because it's needed. And the benefit of it all is that if we have this type of support and it's widespread, we can put a dip in the maternal death rate. It's bigger than, just a benefit or just being at the bedside. The overarching goal is to decrease maternal health disparities and lack of access deserts, and death because we're trying to bring life into the world.
Yes, I hear you. And it's funny when you were talking about maternal trauma, right? At first, I was just listening to your story, but then you introduced the concept of the woman who doesn't have children, right? Some people, it's like child free, right? There's a that I hear that floating around. I think people who identify as child free, that's a choice they've made, right?
Yeah.
And so when we talk about infertility, or someone like me who just hasn't had children, um, it's not a choice, right? But that's just where we find ourselves. And so when I heard you talking, I think like even maybe I mean, certainly it's easy to see the person who's gone through infertility and pregnancy loss has had trauma. But it wasn't until hearing you talk that I felt like even maybe I have had trauma because of how many times I've had these conversations with people who are sorry for me that I haven't
Right.
had children, right? And the hundreds of times I've had to respond, and my response has changed over the years. Um, but just it's so funny that you just said that, and I just thought, like, actually, I relate to this story, interesting enough. I'm curious, with the services that you're providing and your background in tech, are you thinking of creating any sort of app that can help facilitate any of these initiatives or enhance the services that you're providing?
Yeah, I would love to in the future create an app with all of our resources, but also be able to have employers and their employees be able to access the app. Just if you only need specific resources, you could go on the app, search these doctors, search these resources, search for grants, search all of these things, and then be able to ping us, chat us if necessary. That would be the goal. That is the goal, and that would be awesome. We're working towards it. It's not there yet. We're still establishing our resource hub, but definitely look forward to it.
Yeah, I do too. And maybe actually it can even, it's when you come to the table with other dreamers, it takes your dream to another level, right? And so you're talking about accessing your app, and I think that's wonderful. And I'm thinking about having it integrated into the EMR, right? Because we talked about that workflow before. We know
Yeah,
it's going to be so much easier if I can just click in a place I'm already clicking.
right, right. That and discharge. I actually just spoke with an organization yesterday who is putting our organization on the discharge summaries of their patients as a QRS code. That
Oh.
is so convenient because if we don't look at anything, a lot of times we look at the discharge summary. We refer back to it, we give it to our primary care when we follow up after the hospital, all these things. We refer back to it when we left the office and forgot everything that the doctor had told us and everything we talked about. We looked at the discharge summary. So to have it accessible there would be awesome for patients to be able to scan it with their phone, pull up the website, look at resources, give us a call.
Yeah, because that's easy, right? We don't
Easy.
that's so that can be done immediately. All the other things we talked about take a little bit more time and people.
Right.
Um,
And searching,
yes.
because one of those things that I didn't do, wasn't willing to do, and didn't have the time or energy to do, was to search for resources. I wish they were more in my face during my journey, because like sometimes I don't have the mental capacity to think about what I need, then go and research what I need, you know.
Yes, that's a wonderful point. And so when we were talking in our brainstorming session, you mentioned that this would kind of start in the emergency department, right? Because that's where that point of entry is often in the healthcare system. So, the first sign might happen, symptoms might happen at home. You're then coming to the emergency department in most of these cases. And so we start talking about like a triage system,
Right.
right? Do you want to talk about more about what that would look like?
Yeah, absolutely. So when you come in as a patient, especially a maternity patient, depending on the hospital that you go to, like for example, one of my experiences was that I went into the ER at 15 weeks. You could not go to the maternity ER until you were 20 weeks. So further along, a lot of times the ER doctor is just like, I wish I could send you to the maternity ER, because we're equipped, but we're just here to stabilize you. You need a different level of care. That's where we would come in and provide those resources that you need, especially if they're thinking about discharging you. We can tell you, oh, you need to follow up with a reproductive endocrinologist, an OBGYN, probably a geneticist, a maternal fetal specialists. These are the doctors that you need to follow up with, because you were in the ER for a short period of time. You didn't get admitted. You wasn't seen on the maternity units that you probably would have received a little different care from. But you can stay out of the hospital by seeing these doctors in the near future.
Yeah, and so when I heard your vision for that and that kind of triage, because I think we had talked about maybe there being like a number system and it can let you know like, okay, they need this, they need this, they need to go up right now, or
Yeah.
they can sit in the waiting room, or maybe they need to be escalated to that's area that you talked about. When you told me that, I had just listened to Dr. Farah Laurent, who is the host of the Nursing Dose with Farah podcast and a member of DMPs of Color, which we will be happy to welcome you in at any time. And she had on the great Dr. Lucinda Canty, and they were talking about this very thing. So Farah used to, I don't want to say used to be, a lot of her experience was in the ED, right? Once an ED nurse,
Mhm.
always an ED nurse. And exactly what you said. They're equipped to stabilize and handle emergencies, but that specific maternal care, there's often not enough training. And I think she had mentioned that the Emergency Nurses Association is working to address that. And
Yeah.
um, she also shared her personal story that as a mother, and I think this was her most recent pregnancy, she had a hemorrhage. And so she went to the ED. She was sitting they left her in the hallway, and she recognized, like, wait a minute, what am I doing? I have to speak up for myself. And so she started screaming and was like, if you don't get me out of here right now.
We have to do it sometimes.
Yeah. And she was just like, look at what I went through as a professional. Think about all the people who don't even know to do that, right?
Right. Right.
And so I think these initiatives that you have presented are certainly needed. And so we're hoping this platform introduces you to more people like Dr. Lucinda Canty. She recently got her PhD. She's going to be coming on the show to talk about her research. To me, she's just like a pioneer in the maternal health space. She's well respected, well known. She just opened up the Lucinda House up there in the Northeast. And so I'm hoping to get you in touch with her. We want to thank Charity Bean for already making that connection. And yeah, we just want to help support you in whatever way we can to get this moving forward. I'm super excited because you'll have the opportunity and support to do just that in your DNP project. And so we want to have you come back so we can hear about that, the outcomes of that, and see where you go, you and your business. And so as we close out, I want to talk about your business a little bit, right? Because you talked about that you got some help. And so in the last few episodes that I've been recording, I've been talking to my entrepreneur friends about this whole idea of getting help. If you remain persistent and consistent in your business will grow. And at some point when your business grows, you will need help. And while nurses have the skill set to do it all, and we have found ourselves doing it all. That's not the goal. And we don't want to encourage you to stay there. And so what I've been encouraging people to do is create these nurse internships, because our value is so much more than what we do with our hands. And we kind of struggle with that because so much of our curriculum and our standardized exams do focus on those skills. So when you hear things like soft skills, transferable, we are really lost in the dark. And when we get burnt out, we leave the industry altogether because we think we have nothing else to give. But that couldn't be further from the truth. And so many of us are recognizing that we can leverage our expertise. And so we're starting businesses, but all we're doing is moving from one setting to another. And we haven't adapted that business acumen. And part of that is knowing how to build a team, how to vet people, and to be willing to admit, I need help. I need to trust people. There's a trust factor. I mentioned that before. As a patient and as a business owner, there's a trust factor in letting people into your business. There's ways you can legally protect your information. And so you're one of the many people who I've chatted with lately and encourage you to start an internship like I'm doing with the Mahogany Telderm Nurse Internship. But you, my friend, have taken that baton and ran through. If you could just share a little bit about what you've done to create that team.
Absolutely. Dr. Kim, first of all, I have to thank you for even like putting the seed, because Lord knows I was stressed. I was like, oh my God, I cannot do everything, but I'm doing everything and I'm not sleeping at
Yeah.
night, because when you're excited about something, it interrupts your sleep. Like when you're obsessed with your goal and stuff, like I am, it interrupts your sleep. You just can't rest because you're like, oh, I got to do one more thing. I just had this idea, and it wakes you up and you just have to
Mhm.
work. But that's not sustainable.
Yeah.
And you made me realize that. And I'm so happy that you planted a seed of internship, which I've also started a mentorship, because a couple of my interns are actually going down the nursing route, and I love that for them. And one of them wants to be a maternity nurse, so this is like the perfect job for her. So there are people out there, students out there who are just craving for that experience, and you are craving for a break and a night of rest. So please, please, please get help. Turn into a mentorship where you can. With my interns, I'm paying for whatever certifications they want. I also buy them lunch. I'm not selfish. I'm very generous as much as I can be, whatever questions they have about the healthcare profession, and whatever other internships and other people I can connect them with, like other organizations and people like Dr. Cameron connecting me with. I'm doing the same with them so they could get the experience that they need to elevate their careers. We're updating their CV, we're updating their LinkedIn, because they're really doing the work and they're doing it really well after I train them. I mean, I'm very impressed. Very, very impressed. I feel like there has to be a change in nursing school too. I'm not in academia. One day I do hope to be. I want to give back, but we have to start incorporating like nurse informatics and entrepreneurship, because we're so trained to look at different specialties within a hospital that to hear a nurse be an entrepreneur or go into this other specialty, which we don't even hear about sometimes until you're in your graduate school phase, you know, it becomes a shock to us that nurses are doing something outside of the bedside. And that shouldn't be, because there are so many things that we can do, so many things. So, so so much gratitude to you, Dr. Kim, for all your connections and networking and planting all these seeds and your brilliant, very brilliant brain. I'm just so grateful.
Well, it's partly because I don't have children, right? I have free time. There are some benefits to that. Well, I'm just so proud of you. I'm so grateful that something I've said
Thank
or done has had a positive impact on you. In my life, when I look back, there's been a lot of patterns. And one thing I've noticed is God has taken me the long way to do mostly everything. But it has really benefited me in the long run, because now, just like you, I can empathize with people who've been on both sides of the fence, right? And so you're a beautiful demonstration of age is just a number, that getting help can actually help you grow further and
you.
faster, because you leave money on the table when you're trying to do all the things, right?
Yes.
Get your life back. We love patient care. I will be the first to tell you how much I love it. But both of us have been in this thing for more than a decade. So we can
Yes.
honestly tell you that at some point in your life, you might need to use your skills in a different way. And sometimes one of my favorite areas of nursing is population health. So I can only see so many people in a day, right? I'm human. But when
Right.
I step back and I look at interventions that can help a whole community, a whole state, a whole nation, I help so many more patients that way.
Yes.
So not only is the impact greater, maybe the time that I'm spending at work, you mentioned 80% of our time, is less because maybe our priorities change. Maybe I want to spend more time with the family. Maybe I want
Right.
to spend more time at church or building a ministry or building a business. Maybe I just want more time to go hiking,
Right.
live that soft life everyone keeps talking about,
Right.
right? Write
Allegedly.
books, write articles, mentor, give
Yeah.
back. And so you're a beautiful demonstration of that. I'm so, so glad to see that you immediately you took that and you're going to help me. And that's the beautiful. And so many people, we'll close on this note, talk about, I'm a big dreamer and I
Yes.
talk a lot. I share my journey on the internet every day. And as a case study, because of all the things you mentioned, right? We don't get it in nursing school. A lot of things you
Yes.
find out in grad school, but a lot of people don't go to grad school.
Right.
And so they're not finding out. Social media has been really beneficial in being able to bring attention to the different ways that we can leverage our expertise. So that's wonderful. Um, but I share my dream, not all of them, but I share a good number of them. And had
Mhm.
I been quiet about this idea, you would have never known about it. I would not know about how you've been able to optimize your organization and communication. And so both of us have been able to benefit by
Right.
just sharing. And of course, you have spirit of discernment. Maybe you can't share with everyone all the time, but you just have to have that conversation and really get to know someone to decide if this is a good opportunity to share what you're
Right.
thinking about or how you're feeling. So thank you so much. We look forward to having you back, hearing about your journey. Certainly come back if you want to add on another service to your business. You want to talk about another initiative, and we definitely want to hear about your research. Uh,
Yes.
any final words you want to leave with the audience?
Yes, I just want to thank all of those, like Dr. Kim, and all the organizations, everybody that I've come across so far since starting this nonprofit has been just so amazing and so welcoming in this community. I love us. I've always loved us, but it's just different when you start and you birth a different baby, which is my business, and people are so receptive and they're like, your story needs to be told, and we want to see you at conferences, and we want to help spread your business and things like that. I'm so grateful for our profession and for all the people I've come across so far. It's been overwhelming in the best way, and it's been healing because I definitely need this type of healing. So much gratitude. And to those going through the pregnancy journey, the fertility journey, and feel defeated, you know, I'm here, we're here, we see you. And for those who don't want kids, that's okay. Ignore everybody, that's okay too. We see you too. And it's okay to live your life the way you want to.
Thank you. Yeah, so much of our community, right? We've had struggles personally and professionally. We can go through challenges,
Mhm.
but we can all, if we continue and we have the right people around us, we look for those people, we create opportunities that we need, we can find that light.
We can. We can. And everybody's light is different, you know.
Exactly. I think we've tried to emphasize that in this episode.
Yeah. Yeah. So,
Well, thank you again so much. Remember, everyone, you can email us your questions and show ideas to tmi.melanin@gmail.com. If you haven't already, this is your chance to subscribe, leave a comment, give us a thumbs up. It lets the algorithm know that this information is important so that when people like you look for information like this, we show up higher in the search results, especially on Apple and Spotify. We'll have all the information we've talked about today, as well as how to connect with Rochelle in the description box. At the time of this filming, we release new episodes every Sunday at noon Eastern, all the video, YouTube, Instagram, Facebook, LinkedIn, and then the audio we drop at 5 a.m. on all your favorite podcast apps so that the night shifters can be the first to get something and not the last. And our day shifters have something to listen to on the way to work, and maybe one day someone will play it during huddle. We thank you again for watching and listening, and we'll see you next time.